Ani, and welcome to the International Overdose Awareness Day presentation, brought to you by the Whitefish River First Nation Health Center. An overdose means having more of a drug or combination of drugs than your body can handle. There are several signs and symptoms that show someone has overdosed, and these differ with the type of drug used. All drugs can cause an overdose, including prescription medication prescribed by a doctor. It is necessary to know the right amount and the right time to take your prescription medication. Equally important is understanding which substances and drug combinations are lethal when mixed. I will now speak about some substances and how they may result in an overdose. A depressant is a drug that slows the vital activities of the body, including breathing and heart rate. Depressants may also be known as sedatives. Opioids such as heroin and pharmaceutical opioids like codeine, oxycodone, morphine, benzodiazepines such as Xanax or Valium, and alcohol all slow the central nervous system to produce a calming effect. When taken in excessive amounts or in combination, they can depress normal functions such as breathing and heart rate until breathing and the heart eventually stop, resulting in death. People don't automatically think of alcohol when they think of overdose, but alcohol is a depressant, and it is possible to overdose on it. Acute alcohol poisoning, which is usually a result of binge drinking, is an example. If you drink a large amount of alcohol quickly, the level of alcohol in your bloodstream can become dangerously high. This can stop your body from working properly. In extreme cases, alcohol poisoning could stop you from breathing, stop your heart, or cause you to choke on your vomit. It is possible to overdose on stimulants like amphetamines, such as speed and ice. Amphetamine overdose increases the risk of heart attack, stroke, seizure, or drug-induced psychotic episodes. It is important to understand tolerance and drug half-life. If someone uses a drug regularly, they develop a tolerance to it. This means they need to use more of the drug to get the same effect. Just as a person can develop tolerance, they may also lose it if they haven't used a drug for a while. When people take their usual amount of drugs after a break from using, it could be too much for the body to cope with, and this may lead to an overdose. This is why periods of abstinence from drug use, such as after a release from prison and after a period of detoxification or rehabilitation, are risk factors for overdose. Half-life refers to the time it takes for a drug to drop to half the strength of its original dose. Some drugs have a long half-life. A person who has taken drugs may still have enough in their system the next day to overdose if they use more. Here are some statistics around opioids in Ontario. In 2003, there were 1,858 cases ending up in the emergency department. Of these, 1,185 resulted in hospitalization, with 366 ending in death. In 2018, the number of emergency department visits jumped to 9,154. 2,108 resulted in hospitalizations, and 1,473 resulted in death. This chart outlines the types of opioids that were present in the body at the time of death. Fentanyl began to be a greater issue around 2015 and exceeded 1,000 deaths in 2018. Drug categories outlined in this chart are not mutually exclusive. Multiple drugs may have been present in a single death. This map shows that per capita, Northern Ontario has a higher rate of overdose death than most of the population-dense southern areas. All drug misuse can lead to brain injury. Hypoxic brain injury, which is caused by a lack of oxygen to the brain, can lead to coma, seizures, and death. The long-term consequences of hypoxia depend on how long the brain is without an adequate supply of oxygen. The longer a person is not breathing, the more damage is done to their brain. In severe cases, brain injuries from overdoses can leave people in a vegetative state. A range of signs and symptoms can occur when a person overdoses, and everyone responds differently. Signs and symptoms depend on a variety of factors, including which drug is taken, the amount taken, and the person's state of health at the time. If you can't get a response from someone, do not assume they are asleep. Sometimes it can take hours for someone who has overdosed to die. An overdose is a medical emergency that requires immediate medical attention. Always call an ambulance if you suspect someone has overdosed. People are often reluctant to call an ambulance for fear of police involvement. However, you should always call an ambulance if you suspect someone is at risk of overdose. Seeking emergency help isn't just for when someone is unconscious. You should also seek emergency help when someone is having a seizure, experiencing severe headache, experiencing chest pain, experiencing breathing difficulties, are extremely paranoid, agitated, or confused. Someone doesn't need to have all of these signs or symptoms for them to be overdosing. Exhibiting one or two could still mean they are in trouble and need emergency help. Snoring and gurgling can indicate that a person is having trouble breathing. With substance use, especially substances that slow down the system of the body, snoring may indicate a serious and potentially life-threatening obstruction of the airway. In the context of substance use, snoring is not something that should be seen as normal. Don't let someone sleep it off. If they are snoring, this may be a sign of a significant and life-threatening emergency. You should attempt to wake them immediately. If they do wake up, then the airway obstruction will resolve. If they do not wake up, call emergency services. Naloxone is the drug used to revive people who have had an opioid overdose. Naloxone can cause withdrawal symptoms and a powerful urge to take more of the drug that led to the overdose. Anyone who has been revived using naloxone should understand the risks involved in taking more drugs afterwards. Taking more drugs after being administered naloxone can result in a second overdose. This is because the half-life of naloxone is considerably less than heroin and morphine. Drugs like methadone and sustained-release opioids such as oxycodone release doses of the drug slowly over 12 hours or more, so the effect of the naloxone will wear off long before these drugs have left a person's system. Miigwech and thank you. If you have any further questions or comments, please contact Michael Alick, Mental Health and Addictions Worker at the Health Center.